Hello everyone, welcome to EPG Pathshala. I am Dr. Roshan Livingston, working as a medical physicist in the Department of Radiology, Christian Medical College, Vellore. The module that we are going to learn today is on image quality. This comes under the broader topic of radiation biophysics. What is this image quality we want to talk about? Without proper image quality, we will not get good information. Image will be so noisy because there is less signal. Generally in radiographic imaging, we need more X-rays to produce better image quality. But however, there should be optimization of radiation dose. Bearing in mind image quality is also important so that it is of diagnostic value. Hence it is crucial to see what would be the right radiation dose to be given to produce good image quality. Image quality also is dependent on detectors. Detectors may be from film screen, computed radiography, digital radiography, or CT, that is computed tomography, MRI, ultrasound. All these imaging modalities have their own kind of image quality which needs to be tested. The quality of radiographic image plays a vital role in conveying valuable diagnostic information to the clinician. So what would be the ideal diagnostic quality image? Good quality image requires acceptable noise, good image contrast, and adequate spatial resolution. So what would be the objectives that we are going to study today is to know the basic components contributing to image quality, to study the factors that affect image quality. Let's see what are the basic components. There are three important main components for image quality. We discussed earlier, we need good image quality for good diagnosis. One is the noise, second is spatial resolution, third is the contrast resolution. Let's consider the component of noise and go on to resolution. Actually, resolution has both spatial as well as contrast. What is this noise? I tried to get a photograph from a television where a person is playing tennis. As you can see behind the blue background, someone is playing tennis and you can see the lines that are drawn in the tennis court. But the image is so mottled. So we did not know whether there is a person there or it's hard to identify whether there is a tennis court. So this kind of image is not good for diagnosis because it is noisy. Why is this too noisy? When you sit before a television screen, earlier days we see it's a mottled image. Then what we do, we need more signal. We get better gain in the amplifiers and then get better signal. So more signal, better noise. More signal, better image quality. So more signal, we have to reduce noise. So our main criteria is to reduce noise and improve the signal with optimized radiation dose or optimized signal for radiological equipments. Let's see this noise. Real image consists of two components. A meaningful pattern carrying signal about the subject, which is called a signal. A spurious, chaotic pattern carrying no information, which is called the noise. The presence of noise limits the amount of information which can be extracted from the image, as we saw in the television mottled image. The signal to noise ratio is a measure of true signal reflecting the actual anatomy to noise, which is nothing but the random quantum mottle. Noise is nothing but there is some mottle because not enough signal coming onto the image. A lower SNR, that signal to noise ratio, results in a grainy appearance of images. In this image, what you see is a CT image where a phantom was used to demonstrate noise. One side we see a low dose scan and the other side we see a high dose scan, and we see the differences in contrast in the high dose scan much better than the noisy low dose scan. Hence there is a trade-off. we need to have better image quality. We are going to have little higher radiation dose of optimal value. Coming to the next part is spatial resolution and contrast resolution, which is part of image resolution. We will briefly discuss and elaborately go on to discuss about these other two components, spatial and contrast resolution. Spatial resolution is the ability to produce an accurate and clear image. Contrast resolution is the ability to distinguish one soft tissue from the other without regard to size or shape as seen in the image. We can see these white circles around showing the kind of contrast resolution, and there is one more small line pair pattern which is kept there, line pair per millimeter is written, that is for spatial resolution. Let us consider contrast resolution. Here we see on the screen this image taken from CT as well as one more image which is taken from a step wedge. Contrast resolution is to identify a feature, that is distinctive attribute on an image. It must appear different from the surroundings. A high contrast means the image appears very harsh with lots of dense black and brilliant whites. That's more contrast. We need optimal contrast value. In some cases, if I want to have good contrast resolution, how do I check this contrast resolution? From a X-ray imaging modality, a best method is using an aluminum step wedge. If you want to do a quality assurance for a CR machine to see whether your contrast resolution is good, one can use this aluminum step wedge to have the pattern which is the contrast resolution. Varying contrast resolution formed by attenuation of X-ray beam due to the thickness of the aluminum in the step wedge creates this image of grayscale. There is also subject contrast. Patient itself is a subject. Here we also see the aluminum step wedge, which is aluminum, is also the subject. Differences in X-ray intensity, that is differences in optical density on the contrast, which is for films, also pixel intensities which we see for digital imaging. Also we can also see the differences in Hounsfield units in CT imaging or signal intensities in MRI. What are the causes of subject contrast? Differential absorption of the X-ray beam, differences in thickness of anatomical structures, use of contrast agent, tube voltage and X-ray beam filtration, scatter radiation which also reduces subject contrast. So scatter radiation, how do I overcome that? By using grids. The function of a grid is to cut off the scatter from the subject and improve image contrast. There is also detector contrast. How good the detector is absorbing, how good the information that is coming out of the detector is seen. So when incident X-rays fall on to our imaging detector, it can be flat panel or it can be films or it can be any scintillation material, it produces a signal in response to that input energy. It may be a very small X-ray input, how the detector is going to behave, or a very high X-ray input, how the detector is going to give the signal. A low intensity X-rays obviously gives you low amount of light or signal, but a high intensity X-rays of course gives bigger amount of light, so better image quality. So small changes in input energy striking the detector due to subject contrast can result in changes in the signal, which is nothing but the image contrast. What is this detector contrast? Different detectors can convert input energy to output signal with different efficiency. As just seen, films will have different contrast. As seen in the image, we have a characteristic curve seen here with a toe and a shoulder. But for a digital imaging, there is no shoulder part. It has wide dynamic range. Hence, the output can be assessed by using this kind of characteristic curves in film and seeing a dynamic contrast in a digital detector. That is about the contrast resolution. Let us move on to this spatial resolution. Let us define spatial resolution. Spatial resolution is the ability of an imaging procedure to produce images in which closely spaced objects can be seen as separate objects or it resolved. So in this image you are able to see line pairs at 0.6, 0.7, 0.8, 0.9, 1, 1.2, 1.4 onwards, where we see these lines are distinctly seen. Here we can also go till 2.5 or 2.8, where we see that these lines are seen distinctly, indicating that the detector which has taken this image is capable of visualizing images up to 2.8 line pairs per millimeter. Hence, it is quoted as line pair per millimeter, and that is the description for a spatial resolution. In film screen combination, that line pairs can go up to 20 line pairs per millimeter. In fluoroscopy, usually 2 line pairs to 3 line pairs per millimeter. In digital radiography, it is 3.5 line per millimeter, and it is restricted because detectors are based on pixels, and the size of the pixel will restrict the spatial resolution. Now we need to distinguish between spatial frequencies or spatial resolution between 2 or 3 different modalities. How do I do it? The best method would be the modulated transfer function, which is called the MTF. So spatial resolution is also related to modulated transfer function, MTF. The resolution of different systems may be compared objectively by reference to the modulated transfer function. The MTF is a useful measure of true or effective resolution. If MTF is 1, the reproduction of the image is exactly as that of the object. What are the factors that influence image quality? Exposure factors, KVP. Let us consider the tube potential, which is KVP. High KVP increases scatter radiation, hence noise. Hence we can use grids in order to remove the noise and scatter, so that it will improve image contrast. MAS, that is a tube current product, is also directly related to the density of the image. All these factors actually contribute to good image quality. Films may demand more, or digital radiography may demand more. We need to optimize KVP and MAS. Then we have filters. Filters affect the quality of X-ray beam. Sometimes heavy filtration of about 0.3 millimeter of copper reduces a patient's skin dose, but also increases the tube potential and thereby increases scatter radiation. This is usually seen in cardiac procedures, where introduction of 0.3 millimeter of copper increases the tube potential and thereby introducing higher scatter radiation inside the room. Another factor that influences image quality is high voltage generator. Ripple free high frequency generator is important currently when digital radiography systems are used. Earlier, half wave or full wave rectified circuits were used for film screen radiography purpose, but still it demands more radiation. Hence, high frequency ripple free voltage is good for CT or MRI or any other device. Next, we move on to a geometric unsharpness, which also influences image quality. There are lots of subdivisions in geometric unsharpness. Focal spot size. By reducing the focal spot size, it reduces geometric unsharpness. Consider fine focus, which is used in X-ray machine. In an X-ray tube, when fine focus is used, the image resolution is much better compared to the broad focus. For certain procedures, fine focus is used. If you consider mammography, 0.1 millimeter is a fine focus and 0.3 millimeter is a broad focus. So for macro radiography purpose, it is always better to have 0.1 millimeter of fine focus in mammography. The dimension of the focal spot, that is 0.6 for fine focus, 1.2 for broad focus in ordinary X-ray machines. So the focal spot is a major contributor for spatial resolution. Second part of this geometric unsharpness is the object to image distance. Reducing the object to image distance reduces geometric unsharpness. Place the patient so close to the image detector always. Generally during a C-arm procedure done in an operation theatre, it's always good to keep the detector close to the patient. Or during interventional procedure, the image intensifier or flat panel detector should be as close as possible to the patient so that we have good image quality. If the detector is far away, it will create image magnification. So focus to object distance is another one which is important. When we increase focus object distance, it reduces geometric unsharpness. What do we see in CT? Those factors what we saw earlier is for routine radiography, mammography, fluoroscopy. What about image quality in CT, a computed tomography system? Slice thickness. If I go for very thin slice thickness, it increases noise. So generally these days we have high-end CT machines with very small detector size. It's about 0.5 or 0.625 millimeter of detector in a multi-detector OCT. If we take a thin slice as close as 0.6 millimeter, the image is little noisy. Hence we tend to increase the radiation dose, the signal is increased and better image resolution. So it plays a role in CT. A thin slice of 0.5 millimeter to 2 millimeter leads to a noisy image compared to a slice thickness above 3 mm or 5 millimeter. With thin slices, high radiation dose is required. But current CT scanners have iterative reconstruction or real-time noise modulations. So it's possible to reduce the noise by predetermining the noise before we acquire an image. And that's what iterative reconstruction does in CT in this current generation CT scanners. We also have the detector quantum efficiency, which is called DQE. Very important to know how good the detector is. It refers to the efficiency of detector in converting incident X-rays into an image signal. For example, an ideal detectable quantum efficiency or DQE is 1. That means all the radiation energy is absorbed by the detector material and all the information which is from the subject is seen on the detector material. So that's the ideal DQE, but we cannot get that kind of ideal DQE. Generally for some of the good systems, we see DQE of about 0.75 or 0.8. Maybe close to 1 is good, but we will not achieve that kind of image quality. What we see in this illustration, input exposure, which is given in radiation dose, signal in, noise is also coming along with that to the detector. When signal comes out, the noise is also out. So we see the recorded image. It also shows DQE equal to the noise from ideal detector divided by the measured noise from a real detector, as seen in that equation. The noise is actually a measured quantity. How do we measure noise in an image? It is possible by drawing an ROI, the region of interest. If it's a CT image, we can draw an ROI and get the noise values, which is nothing but a standard deviation. In case of routine radiography, we can use the same principle by drawing an ROI and getting a quantifiable value of the noise as standard deviation. We also have the problem with image quality when there are a lot of artifacts. Artifacts in the image will degrade the image because it is an unwanted entity. An important problem is encountered in most imaging methods which can create image features that do not represent a body structure or object, that is the artifact. Artifacts can obscure a part of an image or may be interpreted as an anatomical feature. What are the causes of artifacts? Artifacts can be from the patient, detector, selection of a protocol, and then equipment. These are the various things which can affect image quality. If we consider from the patient, patient may move and cause motion artifact. There are lots of others artifacts, such as patient may have a metal implant which can create streak artifacts and create the image with a noisy appearance, degrading the image quality suitable for diagnosis. Then detector, of course. If the detector has poor absorptive efficiency, we may have some blurred images, or in some cases in image intensifier system, the input phosphor will be degraded over a period of time and we do not have good image quality. Also, it depends on protocol selection. We try to take a good protocol with optimized factors. This will have good image quality. But if we try to reduce noise more than what is required, it increases noise and it reduces spatial resolution as well as contrast resolution. It's also part of the equipment. When we see the electronics which are present in the equipment also has noise which can obscure and also present in the image. So when X-rays come into this detector, the noise which is also present, which is the electronic noise of the machine, will also produce noise along with this. That's the reason some machines have real-time noise reduction, because we can understand a machine with this noise and then try to annul or subtract the noise from the signal so that we get better image quality. So these are the various factors we saw. Hence, three major components, which is noise, contrast resolution and spatial resolution, was discussed in this module. Let's summarize whatever we learnt. Image quality can be analyzed in terms of these three distinct interrelated components. One is contrast, spatial resolution and noise. The presence of noise limits the amount of information which can be extracted from an image. In some cases, we can use high MAS and a low KVP to reduce quantum model. Spatial resolution is the ability to produce an accurate and a clear image. Contrast resolution is the ability to distinguish one soft tissue from the other without regard for size or shape. Optimal exposure factors should be selected for optimal image quality. Grids are used to observe scatter radiation and improve contrast. Detectable quantum efficiency is the ratio of the noise from an ideal detector to the measured noise from a real detector. We can use modulated transfer function to identify the spatial resolution between 2 or 3 different modalities. So once you want to purchase a machine or you want to see image quality in a typical machine, it's good to know about these image quality components: noise, spatial resolution and contrast resolution. Hope you enjoyed watching this module on image quality. Thank you.